Hello, and welcome to our presentation about haptic glove rehabilitation. Let's suppose you or someone you love suffer from a stroke. This stroke will lead to problems in coordination, problems in muscle stiffness, speech difficulties, loss of ability to control fine motor muscles, and deficiency in the sense of touch. In the past, researchers have used haptic glove and virtual environment to help patients recover from strokes symptoms. The rehabilitation process always started right after the condition is stable. The procedure began with hospitalization and later continued at home. But these home exercises are difficult. One difficulty is it's boring. The second difficulty is monotonic. There is no change. The third difficulty is the absence of analytical data required for recovery. By introducing our design of haptic glove combined with virtual reality, the researchers removed the cons of the home exercises. The virtual reality we used is different than the one used in hospital. We use simple video games, which bring the cost of the rehabilitation to people who can't afford it. The method and design is composed of three main categories: output, input, and the controller board. The output is 5 small vibro-tactile actuators, which are introduced on the bottom, the top of the glove. The input are 5 force sensitive resistors which are fixed on the bottom of the fingertips. Controller board is composed of Arduino, motor driver, and Bluetooth modem. This controller does 5 tasks. It reads analog input from sensors. It converts these data to digital data. It stores and processes data. It runs the actuators, and it sends data to software via Bluetooth. The reason it runs the actuators is to compensate for the finger that's not moving in order to trigger the movement in that finger. After the data is processed, the data is sent to a software via Bluetooth. The primary reason to have software is we need mapping for the data in the controller to the visual feedback, which are the exergames. The software is composed of 2 stages. One is an interface implemented by Microsoft Visual Studio C++, which is the part that does the mapping. The other stage is the feedback stage, which is composed of 2 exergames, which mean exercise games. The first one is holding the cup game. Players should try as much as possible to uniformly distribute the pressure of each finger on the cup. The second game is ball squeezing. The player controls the force exerted by each finger on the ball depending on the intensity of the vibro-tactile feedback. In the experiment, the participants were 29 years old, about 20 individuals. No stroke history. They have no neurological disorder. They were healthy participants, which begs the question why these participants were not actual patients so that the result can be effective. However, the reason of the experiment is to study the effectiveness of visual feedback on normal people. The experiment was applied in 4 different settings. First setting is the participant was equipped with haptic glove and while watching a movie. The second setting, visual and watching a movie. The third setting, only visual aids. The fourth setting, with haptic glove and visual aid. The user held the cup or squeezed the ball for 12 seconds in every setting. The maximum force and stability was exerted by the thumb in the fourth setting. The thumb has the maximum force and maximum stability. Now it's time to talk about the result. The group that was equipped with haptic and visual feedback had the finger forces values be closer to one another. Each finger has the same feedback value basically, including the thumb. The thumb has very high feedback value. It also conveyed the most accurate results and preferred by the user. The setting that was equipped with haptic plus visual had the most accurate result, and it showed that the user preferred that combination of haptic and visual, and rather than watching a movie and playing the game that with no feedback. When we combine the visual aid plus the video, the results were worse than anything. Now it's time for us to discuss the conclusion and the discussion of the study. Number 1, haptic feedback had an overall positive impact in terms of improving the force exerted on each finger. Number 2, virtual feedback and the haptic glove had no impact when a movie was being watched because of visual distraction. Number 3, combination of the haptic glove plus virtual reality showed that over a span of time, which is 4 weeks, that the user's grip of force had really improved. Number 4, tactile feedback examination conveyed improvement in the movement of user's finger during typing. The conclusion. Number 1, haptic feedback has tremendous impact on managing forces exerted by fingers while user perform various tasks. Number 2, in future, the examination test will be done on the patients, and thus in turn improvement can be made to the model. 3, cloud XR games will also be in future plans to allow therapists constant access to their patients. With that, we finish our presentation. Thank you for watching.